Good morning and a very warm welcome to Bonitas House Call here on SABC2. Bana bamankhaulise ngemthwana, bantu abakaphatha. Abantu akamjokana kanjani? Ngithi nina nonke ebukhosini. I'm Dr Victor Ramathesele. Nina nokuhlisa ngaka katlu. Letla ngwana he South Africa sesini metsotso ha le mashomararo referral le hora ya borobeduse. Now I want to apologize up front and warn sensitive viewers that our subject matter may be a little bit offensive now that we'll be talking sex. Yes, sex. Now, but the reason why as a people we have so many problems and diseases that are sexually related is exactly because we do not openly talk about sex in a responsible way, that is. Now we are going to welcome to the studio Dr. Victor Ramathesele as well as Professor Elna McIntosh. Bona he ke bore a tseba ke bo mathongkhantsisi on ngosheshilizo oqeqe ongoti kulo mkhakha othinta izindaba eziphathelene nocansi noma inkonzo yasekamereni. Ladies, gentlemen, the fun begins. Thank you so much for joining us this morning.
Thank you.
Morning.
Dr. Ramathesele, you are the, is it president or chairperson?
President.
President of the African Society for
Sexual Medicine.
Sexual Medicine.
Yes.
What is sexual medicine?
Sexual medicine actually was started, and it's very young. It's a young science. And the reason why it's a young science is that the study of sex is very new. In fact, sexual medicine as an art and a process is as young as about 20 years old from developing large clinical trials that gave us data. But the key leaders in this process were Masters and Johnson.
Okay.
They started that whole process off in the 60s, 57, 60s.
Masters, we'll come back to that a little bit. Now, you're an MBCHB doctor who went on to specialize in metasexual medicine.
Well, we took an interest
Okay.
and took that forward from there.
Okay.
And as you know that studying sexual medicine is not available easily anywhere in the world, even in our country, South Africa.
Okay.
And therefore that led to me going to Australia to do a course in sexual health,
I see.
and that was a master's degree, and then to write what's called the fellowship of the European Society Sexual Medicine Fellowship. That gives you an idea that we in South Africa don't have a qualification yet,
I see.
but I think that as the days go by, that is something we have to look at.
You would have thought that of all things, I mean, sex would be one of the most studied and researched phenomena. But here it is. I mean, the specialty itself, I mean, is only a few years old. Now, you are more a sexologist.
Yeah, that's right.
Which is what, psychologist in background or behavioral
Actually,
scientist?
I was a nurse. I've
Okay.
got a nursing degree as my background. Most sexologists either come from social work, psychology, medicine, or nursing.
I see.
But like Dr. Ramathesele just said, that we have to leave the country. So maybe a lot of people show interest. Many students phone and say, I want to be just like you. And I'm like, get a basic, you need a basic degree. And from there on, you'll specialize. So sexology is not a recognized discipline in South Africa. And the few of us that have left the country, I think when you start telling people, they go, it's not so much fun.
Okay. All right. Now, as it is always said, the most important sexual organ is the one between the ears.
Exactly.
The brain, that is. But just take us through, for one to have an optimal sexual life, what are the things that need to be in place, Dr. Ramathesele?
You know, when you look at sex being optimal, there is the counterbalance.
Okay.
And that is the relationship must be at its best.
Okay. The relationship between the two people?
Yes.
Okay.
Best relationships give best sex.
It doesn't matter technique or any of the issues that we're talking about?
When you have a good relationship, it doesn't matter about the size of your penis or the largeness of a vagina or whatever's going on. The two of you will just love each other and really build that process.
Do you want to suggest that a lot of problems that people experience in the bedroom emanate from the fact that the relationship itself is not optimal, or it's not?
I would say that a large percentage
Okay.
actually have that. Yes, but there are organic problems that can cause the men to have difficulty. There are medical conditions that can cause men and women to have difficulty. But that is a small amount when you start to consider that relationship difficulty is the largest problem that we have.
Before I ask you what I'm going to ask you, what is the one single problem that causes sexual problems among human beings? One.
the most common
Most common, in other words.
discord between partners.
Discord. Oh, we'll come back to this thing called discord. Now let's go back to basics. You people always refer to what is called the sexual response cycle.
Cycle, yeah.
And I think for anybody who's watching, and including myself, because this is a new discipline, I'm a student myself today. So take us through the sexual response cycle and exactly what it is, both in females and males, because I do think there are some slight differences. But what is the
So
sexual response?
we've just spoken about Masters and Johnson, and they were really the first people. They coined that phrase of the sexual response cycle. And they said first, and so there were 4 steps.
Okay.
And first they said we need arousal, and then we need excitement,
Okay,
and then we hit plateau,
okay,
and then we hit orgasm,
okay.
and then we have resolution, then we rest
I
afterwards.
see.
But we have over the years really criticized this because we don't actually need to follow those 4 steps, and they don't necessarily, because not everybody has desire.
Okay.
I think a lot of women will agree with me. They probably go, whoa, it's Saturday morning. Best we do this tonight. So there's no desire doesn't necessarily need to kickstart the process. And
But
so
it is ideal. So
The
desire
ideal
is
is-
ideal to arousal. So it's desire, arousal, and then, like you say, excitement, and then you get plateau, and then you get
Orgasm.
orgasm, and then after that you get resolution.
yeah.
So anything that can go wrong in that
In
phase.
any one of those phases, also something can go wrong.
Okay.
So especially with the first one, it's that one of the biggest reasons why we see women coming to see us because no desire or loss of desire.
I see.
And then leading to the next phase and to the next phase. So a lot of women might have a lot of desire, but they don't lubricate. Men might have desire, but they don't get erections. Anorgasmia is probably then the second biggest cause why women come and see us.
I see.
And around anorgasmia, around orgasm.
Anorgasmia is absence of
No,
orgasm.
yeah, absence of orgasm. But around that, we can have a lot of other problems. We can have painful orgasms, or in men, we can have retrograde orgasms, or men who come too quickly, so premature, or we don't like to use that word anymore. We speak of rapid ejaculation.
Instead of
premature.
premature.
Premature, yeah.
It's gonna get hot today. now, these steps, desire, arousal, excitement, plateau, orgasm, and the resolution, are they necessarily different in the 2 major species that we have, male and female? And I will come to those groups that are in between.
Okay.
But are there major differences?
Well, the key from this was that is a very linear model. That means a straight line.
Okay.
You get aroused, you become excited, you become plateauic, and you become orgasmic. Very straight line. Now, women are not straight line, ever. So from this progress to Masters and Johnson moving to another process where Helen Kaplan said, this model is not acceptable and therefore we need to re-look at it. And she introduced desire as one of the facets of the beginning of the process.
I see.
But then Rosemary Basson came and said, no, wait, women are still not that linear process. It's a circular model. So the model at present of the sexual response is based on the Rosemary Basson circular model, where there's this inherent need or inherent desire to be sexual. So all humans have that.
I see.
We all have this inherent desire, need, etc., to be sexual.
It's instinctive, in other
It's
words.
instinctive.
What drives desire in men as opposed to women?
From the point of view of looking at a process or from the point of view of being sexual?
Any process, any one of the 2.
Well, if you look at it, men are geared to procreate.
Okay.
And therefore, the desire to be sexual is to satisfy a procreation process.
I see.
That is the natural process. Now that we've established social boundaries around us and created the process of marriage and looked at it from different cultural and societal perspectives, now the aspect of sex has changed
Okay.
from procreation to recreation.
I see. Interesting. Now, we'll take an ad break. When you come back, it's gonna get really hot in the house here. But if you look at all of this, so desire referred to what people would call libido, in other words. And you say, in your experience, one of the major problems that we have, especially among women, is in the first step, which is libido, with desire itself, and orgasm. Now, looking at that, to what extent would culture play a role in some of these issues?
Just before we go there, let me just also say, if we looked at a time factor, the average man, and let's just say average, the average man takes between 3 to 5 minutes to orgasm, and the average woman 14 minutes. So look at the big
So there's
time
still a disconnect.
discrepancy. Apart from the desire discrepancy, there's also a time discrepancy. So there's other factors that play a part. So if she starts off without desire, it's going to take her that much longer to actually get to the next step,
Interesting. So just hold it there. So you've got a big difference between 3 to 5 minutes and 14 minutes. I don't know how nature has created such a disconnect in the times. But when it's ke o taba he ke o mahlomola ka jeno tshwere taba e hlokolotsi ya thobalana ka taba tsa montabo. Re ntse re kopa he gore o re inele matsoho metsi mo ja ditaba tsa rona mohlomong di ile gore di hlohlontsha tsele. Tsena tsohle re etsa lebitso la ntshetsopele ya setjhaba ka se tsena le o ruta le o aha setjhaba ka ditaba tsena tsa thobalana kapa tshebeletso ya ka kamore. We'll continue our discussion on sexual health. Hang on, Ramathesele, you stay with us. A se sepiri a se khupa marabe no ba re fela nyaka re bolela ka go hlokomela re sa rogane go ba mohlomong polelo yona ya nyaka re bolela ka tsona dilo tsa thobalano kwa no Africa borona. Now it's been a very taboo subject for a very, very long time. Now before we get into the nitty-gritty, why has sex become such a taboo subject that is not spoken about openly and freely? What is the actual problem?
I think that if you look at why and how sex becomes open, the only time it'll ever become open is when people are able to talk about it. So why don't people talk about it? It is something considered secret and sacred.
I see.
So there's two aspects to the sacredness and the secretive aspect of sex.
I see. Now, what are psychosexual disorders as opposed to psychosexual dysfunction?
So we can have hours of discussion just around that, but it's always very important to decide, has this person not got a medical problem? We always first will exclude that before we can say it's all in the person's head.
Okay.
So and I always say, for me, this is my patient, it's the both of you. And very often, you know, we don't, if we do sex therapy, we need to see both.
I see.
And often
You can't do sex therapy on one person.
Well, I was taught that the one's dysfunction is usually the other one's distress. And I'm not always sure if I'm seeing the distressed or the dysfunctional one.
I see.
So it is important that we actually look at this relationship as a whole.
Okay.
But we're not always in that privileged position to see that, because you might just find the one person will come and so say for instance the woman comes because she's got a lot of loss of desire, but her husband will say, you will never, I am never going there. So it is quite sad. I think there's also a lot of myths around what will actually happen and to be labeled dysfunctional. Nobody wants to know that I am dysfunctional. You know, very often when we do shows and when we talk about it, people will always end their question with, but am I normal? We all really just want to be normal. And then we would, and that really goes from whether it's penis size, and a lot of the things, if we just look what's happening out in the media at the moment, 50 Shades of Grey has now given everybody permission to talk about sex again in a whole different other angle. And I always, when we can't blame the media, it's wonderful that you're giving us this opportunity today to just dismantle, unpack things and actually give people factual information.
Let's unpack. Let's start now from desire. And move through the whole cycle because we don't have all the time. You wanted to add something?
If we look at desire,
okay,
and
one can go wrong there.
One can come and say, I don't desire sex.
Yeah.
But I don't desire sex because I have pain when I have sex.
I see.
So therefore, it's not necessarily that I don't have desire.
Okay.
I've actually lost desire because I have pain.
I see.
I've actually lost desire because I'm not orgasmic.
Okay.
So because I'm not orgasmic, I don't even want to desire sex.
I see.
I'm not aroused because I got diabetes or I'm taking a drug that's causing like an antidepressant.
Don't rush. So the commonest problem that people will have around desire is because they have had bad experiences and they associate that bad experience with the look.
So that would be put into the psychosexual category of looking at abuse.
I see.
Abuse when they're young, sexual debut, which was painful or did not have good connotations to it, where people didn't grow up with sex being natural and a process that they enjoyed.
I see.
And therefore that can create major problems in the whole desire for sex.
Okay. So the next phase is arousal. Now he has already said there are a lot of medical problems that can lead to somebody who's got desire, but they cannot move to the next step, which is arousal. diseases like diabetes, which affect the nerve or the blood vessels that are innervating or that are going to the sexual organs, some medication that might interfere with that process. What now? Let's look at the two genders. Now, in women, what would cause a woman who's got desire, but they cannot get aroused? What would be the commonest problems there?
So there can be many things. So if we just take it back to, she might have a fear of pregnancy as well. She might have had a previous abortion, or she's already got a few children. But medication, things like contraceptive pill can cause dryness. A lot of women claim I've loss of libido because I'm on the contraceptive pill. So often one has to, it's very important, we call it a detailed sex history. If we see somebody, we actually need to know from your medical, from your previous experiences, and a lot of people feel quite uncomfortable. If you're actually going into sort of almost, we're using a magnifying glass, we want to know what all happened in your life. Because maybe something happened at age 5 that you've suppressed so deep, but only now in later years it arises. We see women in unconsummated marriages who have never actually had penetrative sex. And by the time they come and see you, they've been given so many misguided informations. And the other thing that plays a huge role is religion. For a lot of people, the fear of should you fall pregnant or sex before marriage is a complete taboo. So for a lot of people, the first time when they experience sex is when they get married, but they are also, it's almost like the blind is leading the blind here. Inexperience often plays a huge role.
Okay. Terrible. Now, in women, this next phase, which is arousal, and we'll go to the next one, which is excitement. How does it manifest itself? What changes in the body accompany this next phase now?
So let's say we've got a healthy woman and her body, and I think to have great sex, we also need to be healthy, and that's important.
Right.
So desire will usually start here, often in the eyes. That's why the lights have to be on when we have sex. Women also, as much as men, desire sex. So a lot of physiological things take place. Often in lighter skinned women, we can actually see a red flush in her neck. Her pulse would slightly start raise, her breathing. The pupils dilate slightly. Again, thanks to Masters and Johnson, boy, did they look at sex from a really great angle. It did great research for us. The other
nipples get erect.
That's when the nipples starting to
blood flow coming to the vulval area, and then suddenly there's labial swelling, and there's lovely swelling and a throbbing in the vaginal area.
I can see you talking about this with so much animation.
But you know what happens? The uterus just slightly pulls away to make more space.
Now, what's the difference between arousal and excitement?
Now, the key is that, remember, the desire, arousal, excitement are almost in the same phase.
I see.
In the same phase, because once you get the desire, you get aroused. But remember, in women, women can get aroused without any desire.
I see.
And that has been a pitfall in a lot of cases that were tried for rape.
I see.
Where judiciary actually maintained that people were actually excited by this rape and therefore gave in because they didn't understand that process.
I see.
Now we know that a woman can have arousal, but I don't desire sex.
I see.
But when my thought processes come in where I say, if I get aroused, was the last sexual experience a good one? Was it a good one with this partner? Was it a good one because he's a caring partner? Was it a good one because I have a stable relationship? Is it a good one because he buys me shoes? Is it a good one because he cares for me? Is it a good one because he doesn't hurt me? Is it a good one because he doesn't abuse me? So if all those factors kick in, now I'm aroused and I become even more desirous.
I see.
Because I desire that process.
Now, in men, how is this represented? We have already explained that desire, excitement, which is preceded by arousal, are pretty much intertwined. Leads to the nipples being erect, and finally lubrication in the opening of the vulva, or when the women refer to themselves as wet. Now, in men, how does it? How is this process manifest in terms of the bodily changes that accompany this process?
That graph looks like that.
So they simply get an erection, in other words.
Well, remember that men are very visual. Men are visual, and that is the whole thing. Women are visual, but not as visual as men.
I see.
Men are very visual.
Okay.
When the visual symptoms kick in, they get an immediate signal from the brain all the way down the spinal cord into the pelvic area, and then the blood rushes into the penis.
In other words, a man can be easily aroused by seeing a naked woman than the other way around.
Yeah, women will see a naked man and look right past him.
Yeah.
But a man, if he sees a naked woman, he will get aroused.
Interesting. Now let's get to the next phase, which is the most important one.
So a lot of problems that we can find for men that we
Would be
would
in the arousal phase.
we would think that he's going to get that erection, but for a lot of men they get, I call it panic penis, but really they help me.
They're
Priti.
scared. They're scared.
Just
Look,
frightened.
I'm frightened to get this. So that would be a psychogenic type of erectile problem.
I see.
Whereas the other one, which is organic and comes from disease processes, is usually a gradual process.
I see.
So if you see this young man, he's 24 years old, and he says, Doc, it doesn't come up.
So performance anxiety.
Okay.
So actually when he's on his own, maybe on masturbation, his body works fine. But the minute he's put into the situation and he really wants to be with this girl, he really desires her, but he just gets this, they will describe it as, it's like my mind just went blank. And it is very stressful for those men because we can examine them and find absolutely
Because
nothing
he's
wrong
worried
with
about
them.
something, maybe he's worried about satisfying the partner, he's worried about his
lot of
male
pressure.
member or
Or
whatever.
he
whatever
doesn't
it
know
is.
what to do.
Oh no, there is a problem.
In fact, when you look at what boys had to say as part of a program that's called the Boys Project, boys have said, we don't know what to do.
Jeez.
We don't know how to please the woman. If any education come to us, it must be directed at how do we please the woman? What do we do on this first sexual encounter?
I see. Before I go to the ad break now, what is the importance of foreplay? Is it something that must always be there? Is it something that is ideal? Does it affect any of the stages that we've spoken about?
So as I said much earlier, it takes about 14 minutes for this woman to get aroused. So, and some women do arouse very quickly,
Okay.
but it is really important that we literally have to warm her up.
I see.
But if I am really angry with you, and I really just want to get this over and done with, you know, I'm having what I call mercy sex with you tonight. Just let's have peace in the home sex. She's skipping one whole phase, and she's really not interested in foreplay. But like you described it so beautifully, how the whole sexual response cycle happens, it really has that function because we need the lubrication. Otherwise, the sexual experience is going to be extremely painful for her.
Hold it there. When we return, the big O. We'll continue our discussion on sexual health. Stay with us. Welcome back. You're watching Bonitas House Call here on SABC2. And today we should take a responsible look at matters sex. Now let's talk about big O now. Orgasm in men. What does it represent and what are the changes, physiological and otherwise, that go with it?
Remember that orgasm in men is mandatory. For one simple reason. Man is the carrier of the sperm. So once he's delivered that sperm, he has actually carried out his function from a nature point of view.
Okay.
But the problem lies in the fact that some men don't orgasm. So we have the spectrum of delayed or no ejaculation.
I see.
On the other side, we have men who ejaculate too early. That means their partners, the 5 versus the 14-minute debacle, their partners are saying, look, sorry, this is a difficulty because I am not even into the rhythm yet and you've ejaculated already. Because when a man ejaculates, his penis is going to go soft.
Yeah.
And
So
therefore,
he's unable to continue.
he's unable to continue unless he's young, because if he's young, he can continue because the penis will come up again because of the stimulation.
I
But
see.
if you're over 40, 45, your refractory period is going to get longer, and therefore to start up again takes much longer.
We'll come back to the refractory period because that's the last phase. Now, what goes wrong with women? Now, here's already explained that most men orgasm is almost guaranteed, and that is natural, and that is built into our instinct to procreate, that you need to ejaculate, which means orgasm. So ejaculation goes with orgasm in men so they can deliver the semen into the woman. But women don't have the same obligation from the point of view of procreation, and therefore they do battle sometimes with orgasm. What causes the problem there?
So our bodies were constructed in an interesting way, let's put it that way, because a lot of women know very little about their bodies. They don't even know how orgasm takes place. So it's one of the things that we encourage women to learn about their own bodies, to actually take a mirror and have a good look. We teach women how to masturbate because if she knows what makes her orgasm, it's that much easier to work with her partner. But because of, I've just used words that we are very seldom actually bring up in a public discussion, and in a lot of religions, masturbation is seen as sin. So,
Do you want to advocate masturbation and say it's a healthy and a good thing to do on national television?
Yeah, I am not saying I'm
Okay.
just saying that the
All right.
clitoris has 8,000 nerve ends, and
I
it
see.
has one function,
Okay.
and that is orgasm.
That is his only function.
And so it was put there. A lot of young girls will discover this and be shamed and named when they're age 2 and 3 because they've discovered pleasure.
I see.
And that is probably a wonderful topic for another day. But parents also need to not name and shame their children, whether it's in a shopping mall, because children just naturally like to touch their genitals. But getting back to women, so a lot of things could have happened in this genital area of this woman because she's not orgasming. She's maybe on a SSRI. She's on a antidepressant, so of medication. So a lot of women don't understand that they used to have orgasms, now they don't have them anymore. Then if we just look at things like aging, menopausal woman takes much longer, and just from a disability point of view maybe, or some women actually they have pain, can't open their legs maybe because of arthritis, paralyzed. Sure, the list goes on and on.
But she's giving us some of the morbid answers. We're looking at what would normally would lead to a young woman between the ages of 25 and 30 not achieving orgasm. Is it because the male partner don't know what they are doing, or what exactly?
Well, I think the first thing is that women are not naturally orgasmic. 1/3 of women are not naturally orgasmic.
They're not going to get it, no
They're
matter
not
how,
going to
no
get
matter
it.
how hard they try.
Well, not really, no
that's
matter
sad.
how they try. The point is that they will have to be schooled. So one can use different
They'll
techniques
have to be
get that
educated
going.
on the process.
Remembering that orgasm is a central event. It is not a peripheral event.
I see.
Orgasm got nothing to do with the bottom. Orgasm got to do in your head. And both men and women get the orgasm as a central event.
I see.
And that is why even women who are spinal cord injured can still be orgasmic.
I see. Now, does foreplay improve the chances of a woman getting orgasm?
Well,
the
there's two
sometimes
things.
say?
Foreplay is one, but what they found in studies that penile vaginal contact of between 8 to 11 minutes almost always guarantees orgasm in women.
Without clitoral stimulation.
Yeah, well, you could use that as part of a process. I mean, if sex is happening with clitoral stimulation and that. Remember, the whole act of penetrative sex is that the clitoris is massaged during the act of sex.
I see.
And that is what also gets the whole process to orgasm moving.
Is penetration in itself enjoyable to women?
Oh yes, for a lot of women, absolutely. You see, women don't often admit that they even enjoy sex.
I see.
So men could boast, but women very seldom will discuss. It's not as if they sit in groups. You know, in the 60s, it was a very American thing to sit around and women would have groups like book club and look at their genitals, but not something that really happened ever in South Africa.
Okay.
But because of the media, we talk a lot more, women discuss more. Women's magazines, you can't open a magazine and there isn't a sexual
Interesting.
article anymore. So a lot of education. Like today, we're doing a lot of education. I'm sure a lot of people go, wow, did you know there's something like a refractory period?
And speaking of which, now let's get to the last stage now, because we're running out of time. The refractory space. Now this is when the penis goes flaccid and it's childier now.
So let's take women and men. Remember that women have this capacity to be multi-orgasmic.
Don't say remember. Just tell us that it is that.
We need to remember that because sometimes men forget that.
Yeah.
And they believe that once they have orgasmed, they can stop there.
I see.
If they continue, their partner will become orgasmic in a shorter time compared to the whole first episode or first round of intercourse. Men, on the other hand, when they're younger, can move from one bout of ejaculation and orgasm to another bout without any problem because they will have a short refractory period.
How long is this refractory period? That is the period between rounds. Because we have so many stories out there, people talking about 6 rounds, 7 rounds and whatever. And people, I want to say, these guys are lying to each other. Let's get a sense of physiologically, how long does it take between the rounds
But
for men?
let me get something in place, and this is what's lacking. What is lacking is research into the number of rounds that people do talk about, and we need to research that.
I see.
We need to get data, both from men and women, to say there was 6 rounds of intercourse, not that there was 6 rounds of in and out.
I see. Okay.
So we need to do that.
In the absence of that research?
In
or
the absence
recent
of that
yeah.
research, let's go by what it is. Refractory period can last from anything to 1 minute up to 30 minutes to 1 hour.
Okay.
If you grow older, it can be up to 4 to 5 hours.
I see.
Or weeks.
Oh, shame.
If you're very old.
Growing has got such problems. It does mature certain areas. So, but certainly there are certain things that suffer. And in women, it's also pretty much the same period?
No, so women, we're very interesting because like Dr. Ramathesele said, we are multi-orgasmic, we can be. And then it only also opens up a whole other discussion of do we have G-spots or don't we?
Ah,
we
now that you're
we-
talking about it, yeah.
We are going to talk about it tonight.
We're going to what is a G-spot, now that you're talking about it?
So did you see it in your medical textbook?
Yes.
Did you find it in your medical textbook?
No,
No.
fortunately,
They described
we studied
At the
anatomy
same
together
time.
with Dr. Ramlakan. We dissected the woman, they dissected the
Yes.
woman in second, we didn't see the G-spot,
We
that's for
didn't.
sure.
No, so there are no medical evidence that it
Yeah.
exists. So there's often discussions. So there are the group that says yes.
No, there is
definitely-
medical evidence. Sorry,
Yeah.
there is medical evidence, but not everybody believes it.
Okay. And so it's evidence, then people must believe it because it's evidence.
No, the
Okay.
point is that some people say that that's a figment. Now, the point is that if we look at this G-spot or Grafenberg spot, like they refer to, he was a gynecologist, and he discovered this spot that sits in the ventral surface of the vagina.
No, don't be complicated. What's ventral? Explain
at the
exactly
top.
where
Okay,
it is.
on
yeah.
the upper part of the vagina, facing upwards, and it's about 2 centimeters in from the opening of the vagina.
Okay,
That is where you can find the spot.
okay.
And the point is that if
And
that's-
every woman has it. It must just be stimulated.
well, the point is that not every woman has it. That's the problem.
Okay, they're the lucky ones who have it. Okay.
And because it's 2 centimeters in, we probably would then want the man with the shorter penis to actually find it.
I see.
Because the man with the longer penis is going to go straight past it.
I see.
So there's something to be said, you know. And so penis size, there's all these arguments about it. So isn't that a wonderful reason to actually, why should you need, yeah.
And
now-
why different positions create different processes.
I see. Now, we're not going to have time to talk about positions because we still have a lot of things to cover, Dr. Ramathesele. We'll have that at a different platform at some point because we really want to try and dissect and debunk this whole issue around sex. Now, having said all of this, and clearly that, you know, when there are sexual problems or whatever, it is no point trying to treat one person because it takes 2 to tango so that you can find out exactly what has happened. Let's talk about science now before we go to the ad break. Does science really matter? Let's be honest.
Science matters a lot. And the reason for that is very simple. Remember, at the present moment, sexual medicine is a young science.
I see.
And the reason why it's young, we don't have, like we take somebody with hypertension, they've done studies in over 50 to 100,000 people. We don't have that in sexual medicine.
Okay.
But there is a growing interest in sexual medicine worldwide.
I see.
What will sexual medicine do? Will address and look after issues related to sexuality that cause couples and individuals to suffer from
So
sexual
there is a
difficulty.
market for penis enlargement adverts that we all see around here. There is certainly a market for that. He says science does matter, and I'm sure you'll concur, or maybe not.
No, but the vagina, it's, what is it, 6 centimeters? That's, you know,
Yeah.
there's just so much space, I think. So sometimes there's something to be said for very painful sex with a man who has a very large penis as well.
Okay.
So you speak to some women who they actually not that happy with a very large penis. There's been a study recently again that tells us that in Africa, it's the Congolese men we have to look out for. You know, there's always, you see these studies and you think, who responded to these studies? And they're often not studies. They're very anecdotal, internet research, which, can we even call it research? It's sort of,
We'll continue our discussion on sexual health. After the break, we're talking masturbation and other related matters. Stay with us. Welcome back. Mon name is Sanso Rabelakasta of Sanita Simon of Bonitas House called SABC2. Dr. Ramathesele, is it different with a condom as opposed to without?
Well, there is. In fact, that is why there is so much of resistance to the use of condoms in many countries in the world. One of the resistance used from a point of view of African sexuality is that men say that the condom blocks the natural spirit or the natural form of their sperm. And therefore using a condom is not good for them. Now, is it different using a condom or not? The point is, in studies that have been done, men have said that is different, but it does not alter their heightened satisfaction that they do get.
Okay. Interesting. Now, we spoke about masturbation a little bit earlier. Now, you're quite loath to encourage it exactly, but is it something that people should not feel ashamed if they've done it in one form or another, whether it is during the actual sexual act or on their own?
I think we should never feel shame around any sexuality unless there's what is illegal. Children, animals. It is very important that there's so much shame put in young people around sexuality, and I think especially things like masturbation, and people get ridiculed around it. It is for me just important that people discover their own bodies. If you just look at young people, young little children at play, they love their bodies. They love to run around in the nude, and then we start putting shame in it.
Sex toys?
Sex toys is a whole industry that started. I think it is, there is, of course, a big market for it, but it's just a toy. I always think as young girls, we have lots of toys, we have lots of Barbie dolls. It's really just a toy. It can never replace your partner. And I think we've spoken a lot today just about heterosexual couples. We haven't really even looked at, are we getting there? Yeah, so because often in relationships, some people, it's just part of their repertoire, what they use.
Does it mean if a woman is using sex toys, especially if they're using vibrators and those things, does it necessarily send a message that they don't have a satisfying sex life with their partners, or there are other connotations?
So again, I think it's important that there's communication between partners. Because for some men, it is highly erotic to watch his wife masturbating, maybe with a sex toy, and the next man is so offended by this that there's just such drama in the house. Every year we have Sexpo, an unbelievable large exhibition of, it's a sex fest. You know, it's the supermarkets
well attended, yeah, it is well attended, I must say.
And thousands of people go there, and that's also where people learn. They're like, what is this for? So I often also go to a Sexpo, and I'm almost as clueless as the next person, because the sex toy industry is huge. It changes all the time. There's little picking, rotating. I always have to have I have a lot of colleagues that do sell toys, and they're usually educating me, because it's just a new toy on the market every year.
You said the predatory nature of men makes them the ones to initiate sex, you know, most of the time. Is there anything wrong if the roles are reversed and it is a woman who's initiating sex?
Well,
or does it send connotations of a certain nature?
In fact, the biggest problem is in the partner. Because the partner wants to know, why are you initiating sex? I should be the one. But good relationships are based on initiation from both sides.
I see.
Because one partner gets frustrated if he or she is the only one initiating.
I see.
So initiating that is shared is a very, very binding principle for good sexual behavior.
Let's talk about homosexuality now. Now, when I was studying psychiatry, which is many years ago, homosexuality was recognized as a psychosexual disorder, as there are many others. That's when people have sex that is outside what has been described as the norms. And homosexuality is one of the commonest. We have pedophilia, you have bestiality, you have a few others which you won't have time to talk about.
Sadomasochism was in there as well. It's also out now.
Correct. Now, homosexuality at the time was divided into two phases. I think it was the DSM-3 or something. You had egosyntonic and egodystonic. Egosyntonic was when a person is attracted to another of the same gender, and if it is egosyntonic, they don't have a problem with expressing it, they are not ashamed of it, and they can even practice it openly. Whereas egodystonic is when a person is attracted to a member of the same sex, but they cannot reconcile with that feeling, and therefore they are in turmoil, which sometimes leads to depression and even suicide in others, because they cannot deal with this attraction that they have for people of the same sex or gender. I believe it has changed now, but are people born homosexuals, or is it something that you learn along the way? Let's just finalize that.
So that argument, nature-nurture, has gone on for so long. If you just speak to anybody, they'll say, I knew from when I was very young, I was attracted to same sex. In South Africa, we have huge, we have got a constitution that just says it's okay. So young people today can openly be homosexual, but there are people that are that maybe are now 60 and 70, that didn't grow up like that, maybe got married along the way, and know they're homosexual, but they could never live out. It is just too late, if you want to put it like that, for them. And I think that is very sad, and those people do suffer. There are a lot of people, depending on the house that you grow up in, maybe from a very religious background. And so even in this country where it's okay to be homosexual, you still can't live your life like that. Very sad. We see suicide amongst teenagers, young people.
We see depression, we see all of this.
Yeah.
Do you have the same views?
Well, it's exactly the point, that the nurture-nature process is there. And remember that homosexuality is not looked at good in many religions. And that is the starting point. Because remember, sexuality, or your sexuality, is shaped by your culture, your religion, your societal attitudes, your values, all of that, and your family process. So all of these things contribute to where you'll be. So as soon as you have this process where you suddenly realize that I am attracted to the similar sex, be it to a woman, be it to a man, etc., you start to have a difficulty. And because in our country we have the process where people are allowed to practice their sexual preferences without any fear of the law or being chastised or castigated for it, they can do that and therefore feel more comfortable.
Okay, so the long shot, or the long answer to what I asked is that nobody is born homosexual. It is something that you develop along the way, and it might have to do with the manner in which you are brought up, and it might have to do with some of your experiences as a child and so on and so forth. As there's so much talk about Oedipal complex that is unresolved and all of those things. But that doesn't explain people who are bisexual, does it? Why would some people want to have relations with women at some point and at some point with other men?
Well, I think Kinsey was the one who came out of this process and said, we're all homosexual.
That's interesting. I would argue. I would argue
exactly,
vehemently
because
against it,
whenever you say that, people say, what?
Yeah?
No ways. But he said that we're all homosexual, but then we start to move into the direction that we schooled, firmed in the whole process.
Well, he said on a scale
Scale
from
of 0 to
0
6.
to 6, that nobody's really a complete 0. So 0 meaning completely homosexual, is it heterosexual? Forgotten. And 6,
Completely
yeah,
heterosexual,
and 6 being completely homosexual. So nobody will be a 3. If you're saying you're bisexual, you're not completely sitting. So you're either more attracted to women or more attracted to men. But in your fantasy, so even if you're saying I'm completely heterosexual, but in fantasy maybe, and often if you look at young girls, maybe if you're in standard grade 8, you look at the matric girls and you think, oh, she's so beautiful, and then suddenly you think, oh, but does that make me a lesbian? So when we're young, there can be very confusing
we'll come back to
mixed
this subject.
messages.
It's quite fast, the subject on its own, homosexuality. Is it better with a circumcised or an uncircumcised man? Yeah, I'm asking the lady now.
So again, you know, there are women that actually say that. If it's just from a mother point of view, am I going to circumcise my child? That often, if you look at religion playing a role, culture playing a role, I think most
I'm
mothers.
talking sex here. I said, is it better or is it?
I think
to both genders, let's
uncircumcised,
find out. Sorry?
there's a little bit of extra maneuverability in an
Okay.
uncircumcised man. There's a little bit of an extra inch for us.
Okay. All right.
So the
Fair
studies have shown different. The studies have shown that basically women, see, the point is when you look at this process, when you have a preference for a circumcised male, you will feel good with the circumcised male.
I see.
If you have a preference for an uncircumcised male, you will have and you'll feel good about it.
So there are no hard and fast rules on this
No.
matter.
There's no
Some
absolutely
women
no.
don't actually know the difference.
That's the point that I was
Yes,
asking.
I sometimes say to them, is your husband or your boyfriend? She's
Okay,
like, I
yeah.
don't know.
But dadawethu sizame ngazo zonke izindlela-ke ukwethulela isihloko esibalulekile ngaphandle kokukuphoxa. Uyosixolela-ke la sithi mhlawumbe ulimi lwethu luthela qoshaba khona njengoba sikhuluma udaba olubaluleke kangaka le nkonzo yasekamereni noma indaba zocansi. We'll round back our discussion after the break. watching Bonitas House Calling here on SABC2, and welcome back. Bakais, Mohang Wile Bora, Morocco, Notakoba, Morocco, Mafukat, Museso, Hoto Hobaitana Peba, Morabala, Rebuagal Tabatamutabo. Dr. Ramathesele, how do you summarize?
Sexuality is linked to many processes. And these processes are what build us to become sexual beings. To become sexual beings, we have to be at peace or have to be in equilibrium with all of them. Society, culture, tradition, family processes, our own attitudes, the way we view how we are sexual. And remember that all of these problems can come and arise because of an inability for us to balance these values that we hold dear to us.
And of course, certain medical conditions that we suffer from.
Now, I didn't even add them because that would come as you go along in your life.
I see.
But the basic process comes back to how do we work in our relationships? Because in the end, no matter how much of research you do, you will find that when difficulty arises, the core process is the people who have good relationships always have a good return to sexuality, whether it is post-pregnancy, whether it is post-surgery, whether it is post-amputation of the penis, whether it is prostate cancer, any disease.
Of the penis. We still have to hear more about that one. But anyway, we're going to close it at that. Professor McIntosh, what's your key message?
So for me, leading on to the relationships, I always talk about the 4 T's, and they stand for time and trust and talk and touch.
Oh,
so
beautiful.
we
Can
need
go
to
over
spend
the time? Yes.
Time is so important. We spoke about that 3 minutes and 14 minutes, but just time in a relationship. Trust. If I don't trust you, if I'm thinking you're cheating on me, so trust is, and if trust is broken, it's really difficult to bring that back in the relationship. Talk, like we spoke today. We speak openly. I like this. Give me more of that. And the last one is touch. Skin is actually our biggest sex organ. When we are born, it's our first sense to develop. This is my mother. Her touch is soft. We learn touch in our birth family. It is so important. So my 4 T's.
Oh, beautiful. Now, clearly, I mean, we have only scratched the surface. We'll have to come back, and deal with specific issues now, where we talk about sex and disability, sex and other medical conditions. And I think you promised me that you'll be back here in a few months so that we can, as a team, tackle this
We'd
subject.
love to.
But today, at least, we spoke open and hopefully with responsibility around issues that today are still not being tackled. And thank you very much, Dr. Victor Ramathesele, as well as Professor Elna McIntosh, for giving us so much light and information today. Of course, we'll be back again here to discuss these things in a different light. Holona bohle barati ba tshehetsi ba manuking ba lenanoleng. Taba tsena tsa rona di monate mpa di phuthelo ka kobo e se dikuku tsa lenyalo. But we'll be back next Saturday with Stigma. Oh boy. So Durham City on SABC2 at 8:30 in the morning. Hlanganyela nathi futhi ngokuzayo. Ari kopaneng hape ebekeng e tlang. Thato haile amrena. Thanks for joining us today. And for me, Dr. Victor Ramathesele, ke mo chane mo chicha ke mo rama kwa pa ntloro sa tinege. Take care.